Hi, this is Dr. Philip Cordova with Core Chiropractic. This is in regards to a video our friend Casey Tedrick did on leg length difference and some of the comments. I've just been going through and answering these comments. This particular one, making a static evaluation on a dynamic biomechanical system has no relevance. I understand where you're coming from. I initially look at the first evaluation and first x-ray as a snapshot. Where are they at? Now, I've had discussions with different chiropractors where they say, look, the legs are never going to even out. There's no even point in looking at them. I want to see how they're moving. I want to see what they're doing. So if somebody was this much off, should you do something about it? Maybe, right? Here, maybe, yes, no. It's really, what is that threshold before you decide that a short leg requires some action before continuing on biomechanically? Now, we've seen this. My oldest son actually broke his femur when he was a kid. That leg is longer because of the way the body heals than the other leg. You can see a lateral pelvic tilt. You can see the difference in here. And the more active he is, the more he's going to feel those effects. So we have had him work with other practitioners, and they don't necessarily acknowledge the anatomical difference. However, for us, we want the anatomical difference to be addressed, set the foundation. As long as he's going to wear that all the time, then it's going to make a big difference. Now, if he had a leg length difference and he decided, you know what, I'm not addressing this. I'm not going to wear a leg length heel lift. I'm not going to deal with any of that. Then you might as well just deal with the soft tissue and keep balancing and doing all the things. However, if we can get his foundation straight, now we can make other changes and we don't have to, jump through a lot of extra hoops in order to help him see a difference. By putting a lift in his shoe, he's able to balance out that side, and now he's even. And then we can work on the adjustments. He can work on soft tissue, and he doesn't have to do a bunch of extra things to compensate over and over again for having the anatomical difference. So yes, you have to address things biomechanically. I get it, but I do think that there's a point to making sure that foundation is set, and then working backwards from there.